We live in interesting times for the headlines. Another horror day for the coronavirus pandemic saw the global death toll pass 94,000, although there were tentative signs of hope that the crisis was peaking in the United States and even in Europe. And we're live in the U.S., the United Kingdom, Japan, Australia, Canada, and Hawaii. I'm Alma Angeles. Thank you for joining us tonight. These are unprecedented times. Events unfold and change by the minute. And as the days go by, we watch as our leaders cope with relentless march of this virus and disease. And now to the news. First, in the Horn of Africa, governments together with the United Nations are still tackling an upsurge in locust swarms despite COVID-19 restrictions on the movement of people and equipment. Let's listen in.
Locust infestation is happening in a very wide area, and you find that every time you are trying to control in one region, there is another swarm that is happening in a different region, and it is not possible to control them simultaneously because most of the time they are at different stages. So it requires a lot of personnel and capacity to be able to undertake all the control operation and also managing the surveillance in terms of the ground team. Right now, the rains are beginning, the short rains are beginning, and if the farmers will not be able to grow the crops early enough, there will be a challenge in terms of availability of various foods in the future, given that if the locust infestation continue without being controlled, it is going to impact a lot in the availability of food. In terms of the COVID-19 restrictions, we agree with the government there is a need for the restrictions. However, in terms of now managing the capacities that are being created for the trainings and also even managing the control. For example, when you want to load an aeroplane early in the morning, there is also the restrictions of timing and also locating the swarms because of the curfew. However, we are trying to come up with innovative ways, like reducing the number of populations that are being met at once for the training, as well as also engaging the security officers so that they can allow a small extension of time for the locust scouts as well as the operation team.
I think, unfortunately, because of other things going on in the world, people are forgetting, the problem with the locusts. But it's a very, very real problem. We've seen it firsthand. We didn't believe it ourselves. We thought, the first time they came, they didn't eat anything, so we thought, oh, it's fine, we're going to be okay. And then we've seen firsthand. So, yeah, the people, our community, the small-scale farmers, it's a very big problem. And for the food security of Kenya, especially after a problem like the coronavirus, how are we going to feed Kenya? All of our produce is for local consumption. And, yeah, I think everyone needs to take this seriously and support everywhere you can, because it's a very big problem for Kenya as a whole.
In Kenya, the Food and Agricultural Organization of the UN, or FAO, is training farmers to use motorized sprayers to contain the pests. But COVID-19 has impacted the supply of pesticides as global air freight has been reduced significantly in recent weeks. Today, the swarms remain a serious threat to Kenya and its neighborhoods, with around 20 million people already experiencing acute food insecurity in the region. In a bid to help, FAO continues to promote locust surveillance by communities using a handheld tablet. Now, this records and transmits data in real time to national locust centers and to FAO headquarters. Since 2015, more than 450 of these handheld devices have been distributed to teams in Northern Africa, the Near East, and Southwest Asia. In other news, the International Monetary Fund Managing Director Kristalina Georgieva gave a preview of the IMF's economic outlook amidst the coronavirus pandemic, which will be the center of attention during the 2020 virtual spring meetings this week, or next week rather. Georgieva emphasized the severity of the current crisis, which she said calls for unprecedented action from the fund.
We are still faced with extraordinary uncertainty about the depth and duration of this crisis. It is already clear, however, that global growth will turn sharply negative in 2020, as you will see in our World Economic Outlook next week. In fact, we anticipate the worst economic fallout since the Great Depression. Just 3 months ago, we expected positive per capita income growth in over 160 of our member countries in 2020. Today, that number has been turned on its head. We now project that over 170 countries will experience negative per capita income growth this year. There is no question that 2020 will be exceptionally difficult. If the pandemic fades in the second half of the year, thus allowing a gradual lifting of containment measures and reopening of the economy, our baseline assumption is for a partial recovery in 2021. But again, I stress there is tremendous uncertainty around the outlook. It could get worse depending on many variable factors, including the duration of the pandemic. And crucially, everything depends on the policy actions we take now. We estimate the gross external financial needs for emerging markets in developing countries to be in the trillions of dollars, and they can cover only a portion of that on their own, leaving residual gaps in the hundreds of billions of dollars. They urgently need help. The encouraging news is that all governments have sprung into action, and indeed there has been significant coordination. Our fiscal monitor next week will show that countries around the world have taken fiscal actions amounting to some $8 trillion. And in addition, there have been massive monetary measures from the G20 and others. Many of the poorer nations are also taking both fiscal and monetary action, even as they grapple with this fundamental shock to their systems.
Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, expressed doubt that it is possible to get reinfected with the coronavirus. The Korean CDC reported that South Korea Centers for Disease Control and Prevention, 51 patients classified as cured, have tested positive again. Bloomberg earlier reported that Korean CDC Director General Jong Eun-kyung said that rather than being infected again, the coronavirus may have been reactivated. But Dr. Fauci said he wasn't aware of the Korean CDC's findings. Let's listen in.
I'm not aware of what you're speaking about now, but clearly there have been anecdotal mentioning of what appeared to be reinfection. You have to really be very careful when you say reinfection, because what and we were dealing with this with even Ebola back during the Ebola time, that someone might still, when someone does a test on them, do a PCR on a body fluid of some sort and be able to detect what are likely nucleotides that are not replication competent. So if you're telling me, which I don't think they're saying, that someone has coronavirus disease, they get sick, it's documented, they get better, and then a month or so later they get sick with documented coronavirus disease. I don't think that's what they're saying, but I don't want to jump the gun on it until I see the data.
They use the word reactivate. Is that different?
Yeah. Well, yeah, what reactivating what means is that it depends what you mean by reactivating. If someone clearly is ill and they have virus isolated from them, that you may have a prolonged course. I'd like to see how long they reactivate. I mean, if they were sick and had documented virus, and then 3 months later they had documented virus, is that reactivation or is that infection with another virus? I'd like to see the data before I really comment on that.
Another sad day for the coronavirus pandemic. It saw the global death toll pass 94,000, although there were tentative signs of hope that the crisis was peaking in the United States and Europe. The picture of the unfolding economic catastrophe also became clearer with the IMF warning of a Great Depression and data showing 17 million Americans lost their jobs. But a European Union financial rescue package agreement offered some relief to the barrage of bad news as well. Another 1,700 people died in the U.S. on Thursday, while there were hundreds more deaths across Europe, driving the confirmed global toll above 94,000. Nearly half of all pandemic fatalities have occurred over the past week. But authorities in worst-hit Europe and the U.S. said a slight decline in daily deaths and infections gave reason to hope the worst could be over. Now, Spain has recorded its lowest daily death toll from the new coronavirus in 17 days, with 605 people dying, according to the government. The update raised the overall number of fatalities to 15,843, which has suffered one of the worst outbreaks of COVID-19 in the world, and where the total number of confirmed cases now stands at 157,022. The figures showed the death rate slowing to 4%, down from just under 4% on Thursday, in line with a trend which began on March 25 when it stood at over 27%. The rate of infection also slowed, with 4,576 new cases over the past 24 hours, while the number of people who recovered from the virus rose to 55,688. Although health chiefs say the pandemic has peaked, they have urged the population to pay strict attention to the ongoing national lockdown, which was put in place on March 14 in order to slow the spread of the virus. Meanwhile, the president of the Euro Group of the bloc's finance ministers says the EU has come up with a 500 billion euro economic rescue package for member countries hard hit by the pandemic. Let's listen in.
Of liquidity. The package we approved today is of a size close to 4% of European GDP, plus the automatic stabilizers that are quite powerful to protect European economies in case of crisis. This is totally unprecedented. We never ever reacted so quickly to a crisis as this one. Exclusively. Countries are the only requirement they have is to spend this money in health-related expenditures in cure and prevention. I estimate that each country can have, through the crisis, use 2% of its GDP in this credit line. To answer also the question on the so-called, this is only a slogan, this is a title, Corona bonds. Since I am president of the Eurogroup, there's one thing that I always worked very hard to achieve, which is to not curtail the debate, but also not preempt the conclusion. Also many discussions.
Italy and Spain, with the backing of France and few others, had called for the creation of a financial instrument through a common loan by all 19 countries that use the single currency. These instruments, dubbed Corona bonds by Rome, would pool borrowing by Eurozone countries to spend on the economic recovery after the coronavirus outbreak recedes. The main component of the rescue plan involves the European Stability Mechanism, the EU's bailout fund, which will make roughly 240 billion euros available to guarantee spending by indebted countries under pressure. The EU ministers also agreed other measures, including 200 billion euros in guarantees from the European Investment Bank and a European Commission project for national short-time working schemes. Ministers were close to a deal on Wednesday, but the talks broke down and had to be resumed a day later amid a dispute between Italy and the Netherlands over how to apply the recovery fund. In other news, doctors in Wales in the United Kingdom are urging patients to call the emergency services if they experience the symptoms of a heart attack. At the Glan CLWYD or Clyde Hospital In Rail, doctors are concerned that the coronavirus pandemic might mean that patients are unwilling to come forward and have increased concerns about going into a hospital. Let's listen in.
So we feel that because of the coronavirus pandemic, some patients might be unwilling to come forward, are worried about needing to come to the hospital, and they wait far too long with the symptoms of the heart attack. We want them to still treat their symptoms in the same way as if pandemic is not here. We still want them to call 999 so we can actually treat them in a timely manner. Well, there was some information coming from Italy where a similar situation has occurred, and there were some reports that patients were waiting far too long before seeking medical advice, which inevitably leads to more damage, and people are sicker. They need to spend more time than recovering from the heart attacks, which is not the right thing to do. So it doesn't really matter whether it's pandemic or not pandemic, we can still provide you with a timely treatment for your symptoms. As far as general public is concerned, the main message as a cardiology team we would like to convey to them is, should people feel that they're unwell with the heart, they develop symptoms which potentially might mean that they're suffering from a heart attack, they should seek timely help. They should dial 999 as if we were living still in normal times, and that is very, very important. Timely treatment for heart attack sufferers is very important.
Also, I've read something interesting and some.
Soldiers and Eagle News will be right back.
This program is co-presented by Kubert Industries Incorporated, Electromechanical Trading and Services, The Cooling Expert, Vita Herbs Philippines Green Coffee, Masarap, Mabango at Healthy Pa, Cadrid Corporation, your ventilation and air conditioning specialist. In participation with Rain or Shine Elastomeric Waterproofing Paint, color for protection for your home. Matimco. Matimco is wood. Wood is Matimco. Our Square Variables Incorporated, your trusted UPS supplier and UPS maintenance provider in Luzon, Visayas, and Mindanao. CompuZell Computer Services, ID card and lanyard manufacturer. DN Steel. EMAC, UPVC Roof Corporation.
Mula noon hanggang ngayon, gabay natin ang MTRCB ratings sa matalino at responsableng panonood. Sa sa tamang pagsunod sa MTRCB ratings, ginagawa nating ligtas at makabuluhan ang panonood ng bawat miyembro ng pamilyang Pilipino. Lumipas man ang panahon, hanggang may pamilyang Pilipino, andyan ang MTRCB.
Alamin ang mga dapat at hindi dapat gawin ngayong panahon ng Enhanced Community Quarantine dahil sa banta ng COVID-19. Taong bahay muna ang lahat sa panahon ng quarantine, maliban lang sa mga sumusunod na ang lakad ay mahalaga. Ang taong mamimili para sa isang bahay o pamilya. Ang mga empleyadong kasama sa skeletal workforce ng ilang kumpanya. Mga health worker sa mga ospital at klinik, mga naghahatid ng pagkain, gamot, tubig at iba pang pangangailangan, mga pari, pastor o imam na maglilibing, mga diplomatiko, mga piling opisyal ng gobyerno, mga hukom at prosecutor, mga magsasaka at mangingisda, at mga miyembro ng AFP, pulisya at iba pang otoridad. Dahil delikado ang sakit na COVID-19, higit na hindi papayagang lumabas ang mga senior citizen, mga may iniindang sakit at mga buntis. Bawal din ang gumala at umistambay sa daan. Manatili sa loob ng bahay. Basta't sama-sama at laging handa. Kaya natin to!
This program is co-presented by Curfew Industries Incorporated, Electromechanical Trading and Services, The Cooling Expert, Vita Herbs Philippines Green Coffee, masarap, mabango at healthy pa. Cadwood Corporation, your ventilation and air conditioning specialist. In participation with Rain or Shine Elastomeric Waterproofing Paint, color for protection for your home. Matimco, Matimco is wood, wood is Matimco. Our Square Variables Incorporated, your trusted UPS supplier and UPS maintenance provider in Luzon, Visayas, and Mindanao. CompuZell Computer Services, ID card and lanyard manufacturer. DN Steel. EMAC, UPVC Roof Corporation.
Welcome back. Kyoto became the latest prefecture to ask to be placed under a state of emergency announced by the central government earlier this week, with the governor saying that infections were rising. Take a look. The state of emergency currently covers 7 regions, including Tokyo, and gives authorities the power to ask people to stay indoors and request that businesses close, but there are no enforcement mechanisms and no penalties for those who fail to comply. The governor of Aichi Prefecture had earlier called on the central government to include his region in the state of emergency. And Japan's Sumo Association confirmed its first coronavirus case in a new blow for the ancient sport, which has already been forced to move one tournament behind closed doors and postpone the others. One low-ranking wrestler who had a fever last week has tested positive for the virus, according to the association, declining to name the man or give details of his stable. Dubai opened a drive-through COVID-19 testing center in the city with capacities of up to 250 tests a day at each center. Take a look. In Canada, the Public Health Agency released its data and modeling on how the COVID-19 pandemic will progress in that country. Thomas I. Likeness reports.
The numbers can be quite shocking. Somewhere between 22,000 and 300,000 deaths before the pandemic is over. The Public Health Agency of Canada released several scenarios on Thursday. The strong message, though, is that human behavior over the next few months will determine how bad things get. Canada's top doctor, Theresa Tam, says the key to limiting the infection spread is tight controls. But controls aren't enough. It's one thing to have the rules, but if nobody obeys them, they're kind of pointless. They're not going to have any effect. People simply have to follow the government's direction. They have to stay home. They have to practice social distancing, not visiting relatives. Well, you know all that. We've been talking about it for several weeks now. Tam says even if the controls mean hardships, tough measures must continue. Doesn't matter whether the economy suffers, doesn't matter if there are job losses. If we want to prevent the spread of this infection, the depth of this pandemic, we need tight controls. She says it's the only way to reduce hospital admissions. It's the only way to reduce deaths. These are her words. We can't prevent every death, but we must prevent every death that we can. The Public Health Agency says the fight against COVID-19 will likely take many, many months. It's going to require cycles of tighter and weaker controls. Prime Minister Justin Trudeau agreed with the agency's strategy.
I think even after we're through this first wave, we will need to remain vigilant and we will need to bring in different measures. Normality, as it was before, will not come back full on until we get a vaccine for this. And as you say, that could be a very long way off.
Trudeau adds the government will continue to provide people with the help they need to pay their bills and put food on the table. The pandemic has also taken a toll on the country's economic health. In the last month, 1.3 million people have lost their jobs. Another 800,000 have had their hours reduced to less than half of what they were working in February. Tough times indeed. But you know, Canada's a resilient country. There remains an underlying optimism that we're going to come through this. And you know, many people I've talked to believe that we're going to come through this as better people. We'll have our minds focused on what's important and forget some of the trivial things we used to worry about. In the meantime, I wish you all good health. Take care of others. Take care of yourselves. Stay home, stay safe, and stay tuned to Eagle News for accurate and balanced coverage of the COVID-19 pandemic. In Edmonton, Canada, Thomas I. Likeness, Eagle News. We live in interesting times.
New Yorkers across the 5 boroughs clapped from their windows and street corners for those on the coronavirus frontliners. Here's Joanne Blanco for the report.
When people think of countdowns, they naturally think of New Year's Eve or a countdown to a special event. But now that New York City is the epicenter of the COVID-19 outbreak here in the U.S., the countdown I look forward to most is 7 p.m. when New York City comes out and applauds all of our essential workers. Not just the doctors, nurses, healthcare workers, and first responders, but the grocery store workers, restaurant workers, truck drivers, and sanitation workers who are also out there risking their lives while doing their jobs. Just like what has been taking place in Spain and in Italy, for 2 minutes, New Yorkers cheer and clap outside their windows to show our support while we stay home to protect the people around us. On behalf of Eagle Broadcasting Corporation, thank you to all of the brave essential workers who are out there risking their lives on the front lines or behind the scenes to keep the rest of us safe. We applaud you all.
British Prime Minister Boris Johnson left the intensive care unit after 3 days of treatment for COVID-19. We have more updates. Joining us live is Erica Celestino. Erica.
Thank you, Alma, and that's correct. Prime Minister Boris Johnson was recovering in a hospital ward Friday after ending 3 days in intensive care for COVID-19. The government has urged Britons to stay at home during this long holiday weekend. The 55-year-old leader left intensive care at London's St. Thomas Hospital on Thursday evening and will now be monitored closely during what Downing Street called the early phase of his recovery. Johnson's improving condition came as the government continues to impose an unprecedented nationwide lockdown to try to stem the spread of the virus. While much of the focus in Britain has been on Johnson's health, there is also another concern, which is over the numbers of people infected with the virus, with the government set to extend a lockdown implemented on the 23rd of March. The government currently announced another 881 deaths on Thursday, taking the UK total to 7,978. Alma?
Erica, so what does it mean when the United Kingdom has a lockdown? What is happening in your country right now?
So pretty much police chiefs and politicians have urged the public not to, ignore the UK's coronavirus lockdown rules, especially this long holiday weekend, because it is really warm here. So, people might be tempted to actually go out. Mm-hmm. Some forces have warned they may have to, be more strict. In fact, new laws gave police the power to remove a person to their home and fine people caught outside their homes in groups of more than 2. So that's really pretty much how strict it's becoming. And in the first instance, police officers are to persuade the public to follow lockdown exactly restrictions.
Mm-hmm. Can you be arrested?
Excuse me?
Can you be arrested?
Actually, let's say that those who do not comply will face stricter punishment. But we start with, repeat offenders that will be hit by doubling of the fine each time. So we start, if you have a second offense, you pay up to 120 pounds, up to a maximum of 960 pounds. And also, Scottish First Minister Nicola Sturgeon said it was likely that the lockdown was going to be in a place for some weeks to come yet. Mm-hmm. And her message, quoting what she said, please stay in touch with your family, friends, and loved ones in whatever alternative way best works for you. So we are really always reminded to stay home unless it is necessary for us to go outside. For example, for our needs like grocery and medicine. But besides that, it is for our safety to stay at home.
All right. Thank you very much, Erica. Stay safe, stay healthy.
Thank you, Alma. I am Erica Celestino, EBC correspondent in the United Kingdom, and we live in interesting times.
A state of emergency continues in Japan during the coronavirus crisis. We have joining us live from Japan is Dennis Liu. Dennis, what are your updates for us?
Number ever, and the first infection was identified in Tottori Prefecture, and 455 new cases were newly identified in 33 prefectures. In Japan, more than 6,000 people were infected, including those found during airport quarantine and those who returned home on charter aircraft. In addition, the cruise ship has 712 passengers and crew members, bringing the total to 6,715. A total of 4 deaths were announced in Kumamoto, Aichi, Ibaraki, and Chiba prefectures, with 112 people infected in Japan from the cruise ship. Of the people who have been infected in Japan, Tokyo has 1,708 people. Osaka has 616. Kanagawa Prefecture has 412. Chiba Prefecture has 387. Hyogo Prefecture has 316. Aichi Prefecture has 302. Saitama has 294. Fukuoka Prefecture has 289. Hokkaido has 239. Fukuoka Prefecture has 289. Hokkaido has 239. And in Kyoto Prefecture has 174. Other prefectures that has more than 50 but less than 100 are Ishikawa, Gifu, Ibaraki, Fukui, and Kochi. Some prefectures lower than 50 but more than 30 are Okinawa, Gunma, Niigata, Oita, Miyagi, Shizuoka, Nara, Wakayama, Fukushima, Shiga, Yamagata, and Tochigi Prefecture. While the following, which has 10 to 30 infections, are Yamanashi, Hiroshima, Ehime, Nagano, Kumamoto, Toyama, Aomori, Yamaguchi, in Miyazaki, Mie, Okayama, Nagasaki, Saga, and Akita prefectures. Kagoshima Prefecture has 4, Kagawa and Tokushima Prefecture has 3 each. Shimane has 2, and just today, Tottori Prefecture has 1 person. Other than this, there are 96 employees, including those from the Ministry of Health, Labor and Welfare quarantine offices. According to the Ministry of Health, Labor and Welfare, 117 severely ill people were infected in Japan. The total number of passengers on the cruise ship is 125. On the other hand, those who have been discharged from the hospital due to improvement in symptoms in the last 10 days, 714. Alma.
Thank you very much, Dennis, for all those updates, and we'll see you soon. Thank you so much. Thank you for your time.
Welcome, Alma. Thank you very much. Reporting from Tokyo, Japan, live. This is Dennis Liu. We live in interesting times.
Okay, over in Boise, Idaho, joining us live is Donera Owen. Donera, hello.
Hello, thank you, Alma. The latest update for the current situation in the state of Idaho in the United States is 1,353 cases, 127 hospitalizations, and 24 deaths. Additionally, 13,094 people have been tested. Testing for the novel coronavirus that caused COVID-19 is currently being done on a patient-by-patient basis. Epidemiologists at the local public health districts and the Idaho Department of Health and Welfare are in consultation with healthcare providers and will facilitate testing for the sickest and those with the highest risk of infection. Since influenza is still widely circulating and has similar symptoms, rapid flu tests will generally be recommended to rule out the flu first before proceeding with the coronavirus testing. Currently, there is a statewide stay-home order to fight the community spread of coronavirus. So the isolation order requires Idaho residents to stay and work from home as much as possible while ensuring all essential services and businesses remain available and open. So that includes grocery stores, healthcare facilities, utilities, gas stations, financial institutions, residential and home-based care, and other businesses essential to the safety and well-being of the residents of citizens of Idaho. Additionally, restaurants will still be able to provide delivery and takeout service. So no individual who is sick may go to the workplace or be outside of the home except as necessary to seek or receive medical care in accordance with guidance from public health officials. And additionally, parks and public libraries have been closed and schools have been moved online. The isolation does not prohibit outdoor activities like hiking, running, and biking, but a safe distance of 6 feet must be kept between those who do not live in the same household. So the government states that the isolation order is a crucial step in fighting the spread of coronavirus and ensuring our healthcare system is not overrun with many cases at the same time. Back to you, Alma.
All right. Tourism, must be very effective there, Idaho tourism. The rich have flocked to luxury ski resorts of Idaho. Rural counties with recreation economies registered higher coronavirus rates. But you can get back with me on that. How's Yellowstone Park? Are there still many tourists going over there? And how is tourism? Must be much
I
less.
imagine not, no.
Okay, you can come back with me on that. Thank you so much, Donera. And we'll be waiting for more updates from Idaho. We're really interested. Thank you.
Reporting from Boise, Idaho, USA, I'm Donera Owen. We live in interesting times.
To Australia now, the daily infection rate has dropped below 2% with 81 new cases recorded on Thursday, the lowest since 79 on March 17, compared to a peak of 469 new cases on March 28. So it has slowed down dramatically. Let's see if I have the same numbers with Samantha DeMillo coming in live from Australia. Sam?
Thank you, Alma. In Australia, there are 6,152 confirmed cases of COVID-19 and 100 new cases. We have a record of 52 deaths and 2,813 recoveries. This information is updated as of 6 a.m. Today. In the last 24 hours, 50 fines of $1,000 have been handed out to beachgoers by police for breaching social distancing restrictions. The New South Wales Art Minister, Don Howen, has resigned from government after he was fined $1,000 by police for staying at his Central Coast holiday home, breaching the strict COVID-19 public health order. On the other hand, the positive news, Alma, in this part of the world is that the daily rate of new cases has significantly fallen since this time last week. However, the Australian government and Prime Minister Scott Morrison are urging Australians to remain vigilant, especially since this Easter long weekend. Scott Morrison has strictly urged everyone to stay at home to avoid undoing everything achieved thus far. Instead, to stay safe, families are urged to conduct virtual catch-ups over teleconferencing apps. Australia will also be sending Vanuatu much-needed supplies amid the recent cyclone recovery and COVID-19 threat. Though there are no confirmed cases in Vanuatu as of yet, precautions are being made to reduce and limit the risk of the virus spreading to this small island. There is also a win for frontline hospital workers as healthcare workers are now able to get free parking at hospitals. Brad Hazzard, the New South Wales Health Minister, has said that all staff at hospitals are able to access free parking from today. These workers include cleaners, security staff, health workers, nurses, and doctors. On a more light-hearted reaction to self-isolating, thousands of Australians across the nation are posting videos of themselves taking out the garbage and recycling bins in creative and amusing costumes, as leaving the house is quite a rare treat these past few weeks. Laughter and smiles help us through the toughest times. That's it for now in Australia. Thanks, Alma.
All right. Thank you, Sam, for your updates. Stay safe, stay healthy. Thank you for your time.
This is Samantha reporting from Sydney, New South Wales. We live in interesting times.
In British Columbia, the provincial government has announced a $5 million investment to expand virtual mental health services for individuals and frontline healthcare workers during this pandemic. And we have an update from our EBC correspondent, Jeanette Duazo. Hello, Jeanette. Welcome back.
Hi, Alma, and hello to all our viewers. Good morning from here, from British Columbia. Okay, so April 9, British Columbia Premier John Horgan addressed that this pandemic is causing anxiety, stress, depression, or feeling disconnected due to self-isolation to prevent the spread of the virus. To expand the existing mental health programs and services, the province announced a $5 million funding and launched new enhanced virtual services for British Columbians to have increased access to vital mental health during the COVID-19 pandemic. The Provincial Minister for Mental Health and Addiction said people experiencing anxiety, loneliness, and stress due to lost job, taking care of out-of-school children, or fear of contracting the disease should reach out for help. The province is working in partnership with the Canadian Mental Health Association, BC Division, Foundry Youth Centers, and other community partners to help all British Columbians with mental health needs with focus on adults, youth, and frontline health workers. As these are virtual services, it will also increase access for Indigenous communities and those living in rural and remote parts of the province, as well as those who are currently unable to access in-person supports. The virtual support and care will be offered in multiple languages like English, Punjabi, and Chinese. This $5 million funding is in addition to a coordinated effort across government to reinforce virtual mental health services for children, youth, and students related to the COVID-19 pandemic. The new services include virtual counseling services, online video and phone-based coaching and skills building program, virtual mentoring and goal-oriented supports, peer support, and practical skills courses for coping with stress, problem solving, and boosting mood. The province will also have COVID-19 mental health assessment tool, which will be available on April 20. The province also expanded funding for the BC 211, a province-wide information and referral service to include virtual mental health support for seniors. So the BC 211 was introduced earlier with this COVID-19. It is a service that matches seniors with volunteers to help support seniors in their community with basic needs, including grocery shopping and pharmacy drop-offs and check-ins. So as of April 9, the provincial health officer, Dr. Bonnie Henry, acknowledged the stressful effects of physical distancing and self-isolation, but said that producing positive results. And as of April 9, there are 53,505 tests completed in British Columbia, 1,370 confirmed cases, 858 recovered, and 50 deaths due to COVID-19. The Minister of Health said 30 of the 50 deaths were residents at long-term care facilities. Also on the financial side, the Minister of Finance of British Columbia said that 132,000 jobs were lost as of April 9 due to COVID-19, putting the unemployment rate over 7%. Alma, back to you.
All right. Thank you very much, Jeanette. Always good to hear from you. Thank you for your time.
Thank you for having me. Live from Victoria, British Columbia, Canada. This is Jeanette Duazo. We live in interesting times.
Indeed. And last but not least, joining us live is Alfred Asenas from our EBC Hawaii Bureau. Alfred.
Aloha, Alma. I think we can pick off where we left off last night.
Yes.
About the police.
Yes.
The police stepping up their efforts.
I hope we can show the posters now, yeah.
Sure, whenever they can. But
Okay.
there's also been some new developments here, especially in Honolulu. Yesterday afternoon, the chief of police announced that there will be a series of curfews. Let me show that chart first. So the latest count there shows how many have confirmed cases. But the good news, well, the positive note on that chart, Alma, is that 251 have recovered. That's more than half of the number of confirmed cases as of yesterday. So that, for at least for officials, is very a positive note. And they hope to be able to determine more cases to determine whether they have recovered. So, and they also noted that there were only 7 new cases yesterday. So they look forward to that trend. But what I was saying earlier was that the chief of police announced that there will be a series of curfews starting this coming Friday night from 11 p.m. to 5 a.m. So it'll be on Friday night, Saturday night, Sunday night, and then it will end at 5 in the morning. This according to the chief, it would be hopes to be able to contribute to stop or slow the spread of the virus. Now, some of the details that I want to share with you real quick on the curfew are as follows. So the order applies to all wheeled vehicles on the road, kasama na yung mga bicycles, mopeds, and scooters. The exceptions are emergencies, first responders, and security personnel, as well as those driving to and from work, making deliveries, or picking up medications. Now, residents here will still be allowed to walk within their communities. But again, like we said before, they cannot loiter, they cannot gather, they cannot stop for long periods of time on the beaches, in the parks, because that will contribute to the violation of a possible violation of social gathering, social distancing. So we all, Alma, you also asked about the punishments, how many arrests were
Yes.
made. I think.
Yes.
Well, there's another chart there. I think it's kind of beige colored. As of
Yeah, I hope
the
we can
8th
show
of
them.
April, the police has issued more than 5,200 warnings. 700, I said 400 last night, I think. I was wrong. 700 citations and 41 arrests for violations of the stay-at-home, work-at-home order that came into effect statewide. There you go. That came into effect on March 25. Somewhere down there, Alma, yun yung penalties, no? So,
Okay.
so the penalties is kind of common across the board. It'll range from up to $5,000 US dollars fine, and up to a year in imprisonment, or both, depending on the how many offenses and whatnot. So, and earlier today, the mayor of Honolulu, Kirk Caldwell, also made the announcement to not accept and allow his fellow office city officials to accept any pay raises. So they turned that down, knowing that the coming months, especially given the others have lost jobs, it looks bad on them if they were to accept. So it was a very tough move, and that's very noble move on the part of the mayor. Alma.
Okay, so I think we have another poster there, but okay.
Yeah, they can. There you go. That's
your favorite poster.
That's the poster. That's the one I was talking about last night. Ika nga, derechahan.
Derechahan na.
Yeah, because there's no other way to put it.
Is this your good news?
Well, the good news is that at least according to city officials, is that when they saw the fewer number of cases reported, they're suspecting. I think what they're implementing is slowly working. So it's just a matter of the medical community, the scientific community, being able to identify the cases right away. Sana hindi na mangyari yung nangyari sa Maui Medical Center when there was everyone got blindsided, even the state health officials. So
in Maui.
In Maui, the one that we talked about. Oh, by the way, remember that nurse that who
yes.
agreed to be interviewed anonymous? She is thanking Eagle News for allowing her to make her statement, although very carefully measured, as they're still dealing with the situation. So we thank her also, and the frontliners there.
Yes, we thank her too. Thank you so much, Alfred, for all those updates, and keep them coming, because we will be calling you in a few days' time, or maybe in a few hours' time.
Of course.
Thank you so much,
not?
Alfred. Thank you.
Thank you. Alfred Asenas from Hawaii. We live in interesting times.
And finally, in our news, Colombian policemen visited Bogota neighborhoods, and they gave Zumba fitness classes to encourage and entertain residents stuck at home over their virus fears. Take a look.
La vida es un carnaval y de eso se trata, de que las personas traten de pasar esa cuarentena de una manera positiva, alegre, siempre compartiendo con sus seres queridos con la mejor actitud.
All right, and may we leave you with a word of hope. Together we are strong. Together we can persevere. Getting through this will take everyone working together. Let's do our part. And that's the news for tonight. I'm Alma Angeles, and we live in interesting times.